Investors celebrating AstraZeneca's news. The Dow's at more than 300 points. It's a strong start to the week. With Moderna, with Pfizer, with AstraZeneca, the shares of cruise lines and airlines are moving higher on the hopes that the travel industry will start moving again. My next guest is a former president of the World Bank who's overseen groundbreaking work in ending poverty and supporting the fight against Ebola. He directed the World Health Organization's HIV/AIDS department. He's the co-founder of Partners in Health. Dr. Yong Kim joins me now from Rye in New York. Doctor, it is good to see you. It's always good to have you with us. Three vaccines with the prospect of more to come, and they're all showing remarkable levels of efficacy. Now, I know that it's going to be some time before they get into the distribution stream. But can we now say that we are now looking at the beginning of the end?
Well, this is all really great news, Richard. I mean, I was really quite surprised at the levels of efficacy. And so, what we now know is that they're efficacious, and specifically that these things work in a controlled experimental setting. The next issue is effectiveness. It's a word that there are two different words that we use in medicine. Effectiveness means, can you make it work in countries and actually get it into people? So WHO recently said, having these two vaccines is great, but it's like setting up base camp on Mount Everest. You've still got to climb. And so now the focus has to be on the ground game. It turns out in politics and in pandemics, you need to have a great ground game. How do you actually get it to everyone? I think the AstraZeneca news, if it pans out, if we find that this half dose to begin and the second dose, if that turns out to be indeed 90% effective, it's especially good news for developing countries. The temperature requirements, the Pfizer's minus 70, Moderna's minus 20. Now that we have 2 to 8 degrees Celsius, this could be hugely positive for especially developing countries.
You see, the risk isn't it, that the wealthy nations, OECD countries, sort of can have the infrastructure for the distribution of those more demanding vaccines in terms of refrigeration, and you end up with a haves and have-nots. You end up with a two-tier system. That would be devastating for emerging and developing countries.
It would, but again, now that the AstraZeneca vaccine is out and it looks very good at relatively reasonable temperatures, 2 degrees Celsius, this might be scalable globally. And there are more vaccines coming. There are other countries that have developed vaccines. I'm optimistic, but again, I think that the key is that we have to invest in the ground game, and that includes in the United States. Richard, we still don't have the kind of ground game in the United States that will be required to be able to get these vaccines out to everyone. So the inequalities are not just between countries, they're also within countries. How are you going to get this vaccine out to African-American communities, Native American communities, the communities that are most at risk? You need to have a ground game. And what we found...
Hang on, Doctor. But you say you need to have a ground game, but there's one of the top US generals has been working on this. The army is ready, so to speak, to move in. If we take the UK, they're already setting up vaccination camps or potential sites. What's lacking here?
Well, so it's great that the Army's involved. The things that I've been hearing here in the United States are that the Army's done a pretty good job. But there are things that the Army can do, and there are things, for example, that you can only trust to people who are from these communities. There's suspicion in many directions, Richard. 42% of Americans said they will not get the vaccine because of suspicions. And some of those communities are communities of color, and because of historical reasons, they're suspicious. And so in order to get these vaccines into people, you need people who are trusted to be able to deliver those vaccines. Now, the good news is this, Richard. If we get serious, especially if the Biden administration, from all the signals that we've been hearing, gets serious about putting into place that public health system that up to now has been the only thing that's kept the virus in check in other countries.
Right.
This would be it's an employment program. It's fiscal stimulus. People who are given this money spend it. And it's also a blow for equality because people can actually get the vaccine and protect themselves.
Right, but you talked there about the acceptability of it and people being prepared to take it. The latest numbers that I've seen, and you'll have seen them as well, do suggest that number is rising. It's in some cases over 58%, sometimes it's 68%. So the public in the United States, and I imagine one would see it reflected elsewhere, that surely is encouraging, that people are starting to believe that this is going to work and are prepared to take the vaccine.
Yeah, I sure hope that happens, Richard. And I think the other thing is that as neighbors and people that you know start getting the vaccine and are not having terrible side effects, I think you're going to see that number go up, which is great. But still, the percentage that you're going to have get the vaccine, even if it's 95% effective, for there to be any sort of hope of herd immunity is well over 70%. Will we get there? Well, I think we'll only get there if we have the ground game. And moreover, what if the antibodies go away? And Richard, I failed to ask, how are you? I hope you're feeling better. I saw the story about your antibodies going down. If the protection doesn't last long enough, and if there's another coronavirus that has different spike proteins that are coming next year, we're going to have the ground game in place. So there's a way to deliver the vaccine, put the ground game in place, to prepare the United States for dealing with whatever comes in the future. That's what's needed in the U.S. and everywhere in the world.
Thank you for asking. I'm feeling a lot better, thank you. And indeed, believe me, Doctor, as my antibodies have dwindled, I've questioned myself many times on whether or not, how many times over the years to come. But thank you, sir. We'll talk more about it as we continue. Now.